Hi, everyone. My name is Megan. I'm the admissions specialist for the General Entry Master's program. We are going to go ahead and get started now that it's 4:30. And I would like to introduce Dr. Reed, the Assistant Dean for Generalist Education, who will be starting us off today.
Thank you, Megan. Welcome, everyone. This is a very exciting time. I am so excited to tell you about our program. As Megan said, I am Dr. Reed. I'm going to just remind everyone to mute themselves as they enter. We are going to go over an overview of the Master's Entry program and have some time for Q&A. And Megan is going to continue with an overview of the admissions process and answer some of the specific questions that I'm sure many of you have. So we can go to the next slide. Let me see. All right. So we're going to go over a review of the MSN Team, review of the Rush system, program overview, the importance of diversity in nursing, career opportunities, our opportunities specifically to become a nurse practitioner, and as I said, admissions guidelines, tips for applicants, and questions. Okay, so our team, at the top, you'll see, let's see if you can see my cursor. It doesn't look like it, so that's fine. At the top, I'm listed there at the top. Then we have, I'll go from the right with Marquita Cross. She is our program coordinator. So once you're accepted into the program, there are going to be some very important compliance information as far as immunizations and your program of study, registering for classes. Marquita is going to be expert in that. We also have in the team Nia Murphy, who works side by side with Marquita, who's right below Marquita on this organizational chart. We have, I think I'll introduce our the group who you probably interface with the most thus far. Listed right under me is Molly Spurlock, the Director of Admissions. She is, I think, on the call and is the one of two dynamic duos behind the scenes to get you into the program. The other is Megan O'Malley, who just introduced me. If you have any questions about the admissions process and turning in paperwork, Megan is really the go-to on that. The remainder of the team will start listed on the left is Dr. Terry Gallagher. She's the program director. She's FNP faculty and really helps to organize the program and get everyone through the day-to-day. We have the remainder of our team is our nursing learning lab. You will become so familiar with the learning lab. We have 5 members listed. First is Kirsten Warner. She's the manager of the lab. She is a CNL nurse, and she coordinates the remaining faculty. We have Sonal Patel, Emily Salins, and we have 2 former GEM students, graduates who joined our nursing learning lab. And a little bit about the learning lab. They really help to get you through the courses. They coordinate the tutoring process. If anything comes up and you think you need a little extra assistance, they help to coordinate that. We also have a program in which we help you do self-evaluation to see proactively if you may need some assistance, and they can help you proactively to think ahead about some testing strategies, some concepts that you would like to review before the classes even begin. And so that's our nursing lab. A little bit about the rush system. So if you've been in Chicago, you've seen the building listed Rush University Medical Center right off 290 Expressway. That's one of our newest facilities, and that's home to our hospital. And right across from that is the university, which is listed on the next which is listed on the next line. So Rush University sits kind of, yeah, right across the street from the medical center. If we go through two bridges, you're there at home of the hospital. We have many of our clinicals are at the medical center. We also have affiliations with our Rush Oak Park campus. If any of you are familiar with Oak Park, it is a western suburb that is not far at all via train or 290. Well, if there's traffic, it could seem like it's far, but it's not. But it's not that far. And we also have Rush Copley and Aurora that uh, several students have gone through clinical rotations there, and the Rush Children's Hospital. Let's see if we can mute people that aren't speaking. I'm going to ask Megan to help me with that. A little bit about the program overview. So it's a 2-year program. It's full time. We go year round.
Are you on it?
We go year round. So we have a January start or September start, and each term, I'll go through each term. So if you were to start in January, it's a 15-week term, about 2-week breaks in between. We come back and start right in May. It usually turns out we start in May for our summer term. Then we have a 15-week term, another 2 weeks off. We start back in September, right around Labor Day, another 15 weeks term. And then we have over the Christmas break, there's a 3-week break in between. The class size you can expect to be around 76. So we have 4 cohorts running at any given time. One of our members kind of asked me about the makeup of the cohorts and how we handle 4 cohorts at a time. And when she got into the groove of understanding how the program is run, she said it's kind of like 4 high school classes. There's an incoming group, a sophomore group, juniors, and seniors. So we always have 2 cohorts that are in their first year of the term, and then 2 cohorts in their last year of the term. And each cohort is made up of 76 students. It's an on-campus program, right? We start on campus in term 2. And it's going to be very important that you are available to start term 2 on campus clinical. In response to the COVID pandemic, we have migrated our on campus didactic, meaning in-person classes, to virtual classes. And we have to abide by the Illinois and City of Chicago state guidance for coronavirus, which limits the number of people that can be together for gatherings. And this includes educational purposes. So what we've done proactively, and this has worked well, as Rush is nationally ranked for online learning, in our DNP programs. All of our DNP programs are remote. So we borrowed from the best practices that we know from our virtual programs. So we host via Zoom or WebEx, as this is. We host the didactic portions online, and then your clinicals from term 2 through term 6 are on campus, usually at one of the locations that I previously showed you, but we do have affiliations with other Chicagoland clinical locations, such as Northwestern, Edwards. So you are placed throughout the Chicagoland area. And just to wrap up on that, the first term, your coursework for the first term will be online. So again, you have 6 terms. Each year has 3 terms in it. I told you that was January, our winter, spring, and I'm sorry, our winter, summer, and fall terms. So the winter we call spring, but it starts in January. So it's 6 terms, 2 years full time, including summers, 15-week terms. Let's talk a little bit about mentoring. So each student has a faculty advisor. Your cohort will have one faculty advisor that will work with the group, and this is really a professional advisor that will help students to kind of navigate what is life after nursing school look like for me? Or some of the questions we also hear are, what does where should I get some of my volunteer hours, or how can I get more experience in a certain field? And so your faculty, your professional nursing faculty advisor will help you navigate those conversations. We also have rich experiences in peer mentoring. So GEM mentoring, like a year 2 student will mentor a year 1 student, as well as if you're interested in DNP student mentorship, our College of Nursing Student Council, as well as our SNA, Student Nurses Association, our student-run groups that we have here, and they help to coordinate those activities. We also have faculty-led mentoring opportunities, and these are in specialty areas such as public health. Faculty mentoring is called a public health scholar opportunity, women, children, and family scholar, and a gerontology scholar. So I'll tell you a little bit about those faculty-led mentoring programs. So each student, you're invited to apply to the scholar opportunity, and each student is paired with a faculty member. And some of the outcomes, we've seen people publish scholarly work in journals, present at national conferences, as well as help them with a focus on their capstone hours. And we'll talk a little bit about what the capstone looks like, but it's really your culminating activity for the master's program. Clinicals, again, start in term 1. Term 1, the clinicals are online, remote, but again, in term 2, you are in person from term 2 to term 6 with a total of over 1,300 clinical hours accumulated over the 6 terms. And let's go back.
Sorry about that.
Okay. And then so we get to term 6. Term 6, we have your capstone. So let me tell you a little bit about the capstone process. Excuse me. So your capstone is, again, your culminating activity. So it's a little bit like a master's thesis, right? You assess a population. You then diagnose what an intervention might look like, and you implement a project. You also evaluate it, and then you present it in term 6. And all of this is done similar to a master's thesis. You would write it up, and then you also present it. And it's done over a series of terms. It builds upon each other. Starting around term 3, you start learning coursework that leads towards your capstone. In your immersion is what we call your clinical hours in the last term, term 6. So in term 6, we send out a survey, and the survey asks you to list some of your preferences of where you would want to spend about 200 hours in a clinical unit. We don't always, admittedly, you can't always get your first preference, but many students get their first top 3 or sometimes their 4th top preference. And we match you with availability. Again, coronavirus has had some input into where we've been able to place students, but we've been able to place students even during the current climate into their immersion settings. I'm going to talk a little bit about the clinical nurse leadership certification in the next slide. But also, just to wrap up this slide, we have a 3-day live review session, which focuses on this is to prepare you for the NCLEX. So the NCLEX is the national licensing examination that you take to get a license as a registered nurse. So no matter which pathway, which degree program you go into to be a you have to take your NCLEX. So we use a series of Elsevier products, starting right at orientation, actually. We start using the Elsevier products to kind of give you a sense of what nursing questions are like. And so utilizing those Elsevier products and starting in orientation, and then you get another test in term 2, term 3, 4, 5, and in term 6, you have a 3-day live synchronous review. First, we give you a pre-test. You have the live review. You get a post-test, and then you get a computer adaptive test, which is similar to what the NCLEX is like. Whereas if you're doing a great job, it cuts off. I believe it's around 70 questions. If not, you get the it keeps adapting to the way in which you are answering the questions. I think I'm going to ask, okay, I'm able to progress the slides again. All right, so a little bit more about the clinical nurse leader certification, and what is the role of a CNL. So in addition to sitting for NCLEX licensure to be a registered nurse, this program also leads to your ability to sit for clinical nurse leader certification. So a recent article reported the results of a systematic review of the CNL literature to better understand what the roles and activities of certified CNLs were. They found that 69 articles met the inclusion criteria, and 62% of CNLs were faculty, 12% were in clinical management or executive roles, 11% were working as specialty clinicians, and 9% were working as staff nurses. And certified clinical nurse leaders were focusing on education and practice around topics such as alarm fatigue, insulin practices, physical exercise for cancer-related fatigue, and the results indicated that despite the fact that there aren't, like, you won't see a job description that says CNL, but clinical nurses prepared as clinical nurse leaders are able to utilize their skills in a variety of roles and job titles, such as the ones I just mentioned: specialty clinician, staff nurse, clinical management executive, and faculty. An overview from the AACN of what the CNL is. So the CNL oversees the care coordination of a distinct group of patients and actively provides direct patient care in complex situations. The clinician puts evidence-based practice into action to ensure that patients benefit from the latest innovations in care delivery. The CNL collects and evaluates patient outcomes, assesses cohort risk, and has the decision-making authority to change care plans when necessary. Finally, the CNL functions as part of an interdisciplinary team by communicating, planning, and implementing care directly with other healthcare professionals, such as physicians, pharmacists, social workers, clinical nurse specialists, and nurse practitioners. All right. A bit about the importance of diversity in nursing. So promoting diversity, including gender, race, ethnic disparity in the profession to better represent the patient population it serves has been a specific recommendation of the Institute of Medicine. And of course, most recently, we have seen a revisited conversations around the importance of diversity, just in general, and the importance of diverse perspectives and Black lives and various voices around the table. And we most certainly believe in that and promote that in the work that we do in working with holistic admissions and working to establish a cohort that is diverse. One of the things that we know nationally is that we have ways to go. Currently, 37% of individuals in the United States are from ethnic and racial minority groups. However, only 20% of registered nurses in the workforce are from diverse groups. So why is diversity important? Race, ethnicity, age, gender, sexual orientation, identity, ability, and thought are all very important. The ghosts of segregation continue to haunt the health professions. As I mentioned, only 20% of registered nurses are currently from racial or ethnic minority groups, and it's even less so if you look at groups that are from various sexual orientation or identity. So it's very important to have diverse nursing leaders around the table in order to represent and serve the patients that we are working with. This cursor is getting the best of me. All right. So our graduates work as registered nurses in various hospital and clinic settings as community health, emergency departments, intensive care units, labor and delivery, medical surgical units, neonatal intensive care, operating room, orthopedics, palliative care unit, and pediatric intensive care unit. I pause every time I read these. Each of these I just want to go through and say the acronyms. I want to say ED, ICU, L&D, Med-Surg, but of course, I need to stick to the script because we don't want to use acronyms, and we have not introduced those to you yet, but you'll get to know them as you get into nursing school. It'll be the OR, ortho, PICU. You'll know what those acronyms are. So if you're considering a terminal degree, tuition benefits are here for you if you choose to work at Rush. Currently, the tuition benefit structure is after 1 year of service, you're eligible for 100% tuition reimbursement if you so choose to go into the DNP or PhD programs that we offer here. A little bit about the National Outlook for Nursing. And the 2019 median pay for nurses, annual pay was listed at $73,000. The hourly pay at $35 an hour, and the typical entry level education is a bachelor's degree. And I want to take a moment just to briefly touch on the fact that many human resources departments are set up that bachelor's degree and master's degree students for their first job may start off being hired at the same pay. That's just how HRs handle new grads. I mean, if you think about it, the difference between a bachelor's degree nurse and a master's degree, when they graduate, everyone's a novice. But what's important to note about a master's prepared nurse, especially from Rush, and this is what we hear from our hiring managers all the time, is that the nurses that are master's prepared quickly, once they get over, that initial novice learning period, they quickly distinguish themselves as forward thinkers. And I say especially from Rush, because you are then able to utilize the clinical nurse leader training that you have to identify some problems or trends that you see on the unit. And you then are able to research how to solve those problems and have some real data that becomes very important to your nursing manager. And from that, you quickly are able to then move into manager roles. You are considered some of the leaders in the unit. So that's definitely something to keep in mind when you're thinking about the difference in the type of training and education that you're going to receive. And a little bit about our graduates. So we have listed some of our most recent, not graduates, but our most recent students that we have enrolled into our terminal degree programs. So listed there is Joy. She's going into the psych mental health nurse practitioner. These are all GEM grads who are either going into FNP as family nurse practitioner. our certified registered nurse anesthetist program, and the adult gero acute clinical nurse practitioner program. I don't know if Molly's audio is on, but I think for probably the last 3 years, I've been saying, Molly, is that right? I don't know. Did I get it right? Adult gero acute. All right, there it is. Thanks, Molly.
Thank you, Dr. Reed. We are going to open this up for questions regarding the GEM program before we start to discuss the admissions for the program. So please feel free to unmute yourself to ask any questions that you might have. On the line, we have a former GEM student as well as Dr. Reed available to answer questions.
I wanted to introduce myself quickly. My name's Kate. I was a GEM student. I graduated about a year and a half ago. And I'm currently working the neonatal ICU, and that's where I started working right after graduation. So any questions you guys have from a student perspective, I'm happy to try to answer them.
Hi, Kate. Thanks for joining.
Hi, Kate, and hi, everyone else. I have a quick question. My name's Karen. This is probably a question that other potential applicants have, but is it recommended or not recommended, or is it even possible to have a job during the GEM program?
Yeah, I can start, and then I'll let Kate finish up from a student perspective. So we have followed trends in students' progress if they had a job or not. One of the first things that you need to do is to do a self-assessment. Some people are able to handle multiple tasks and do extraordinarily well. And then some people, when given opportunities to do multiple tasks, something drops. You miss an assignment, you don't do so well on an examination. We find that people often fall into the latter group, especially when they're starting for the first 2 terms. It takes a bit of time to acclimate oneself to what nursing school is like. So we do not recommend that you work for at least the minimum the first 2 terms so that you get a good sense of what your study skills should be like, what going back to school full time is like, just in its basic form, how to answer nursing questions. They're really unlike many other questions that you've had in academic settings. There can be multiple right answers, and you need to pick the most right answer. And it can be the difference between getting an A and B, and unfortunately getting a B and a C. And there are more classes than not where a B is the minimum passing grade. There are a handful of classes where you can get a C, but most of the classes as B or better. Having said that, I'll let Kate give her perspective and what she saw from a student standpoint. But from an administrative standpoint, we do suggest that you do not work at least the first 2 terms, and we bring human resources to you during term 2 to show you what the hiring process is like for our student nurse position. So we do definitely encourage you to start working in term 2, bringing HR to you in a group setting. Kate?
Yeah, sure. I agree with most of what Dr. Reed said. From my own experience, I worked throughout. I think I actually did start in term 1, but it was with my advisor, I know, as a research assistant in that capacity. So I was able to really work with her to make sure my hours worked for what we were doing. And I think anyone who came into the program with a job, the only people who I think it worked for were people who had either been at the job a while or who were really like friendly or just had a very flexible boss, like someone who they knew very well. Anyone else I knew who started beginning had a hard time and had to stop that job and then start later in the program. So I definitely agree with Dr. Reed that after term 1 and 2, you kind of get a better sense for how you study and how you manage clinical and the didactic courses, and then it's a little bit easier to get into working. So I was able to be a research assistant, like Dr. Reed mentioned. Many people, not most, but many end up being nursing assistants at the hospital. And there are other sort of work study opportunities that you can look for as well. And those kinds of jobs tend to be, I think, the best because those people who are employing those jobs tend to know that you're a nursing student and know that you need to be a little bit more flexible. But certainly anyone I knew who had a job that required like a very structured schedule, it was pretty difficult just because from term to term, your schedule is going to change. I know things like with COVID have made things change at the last minute, and in general, sometimes with clinicals, things might change, and it's just challenging if you're trying to balance all that and a job outside of it. So definitely by term 3, it's much more manageable, but I think to come in term 1 with a job might be challenging.
Thank you.
Hi, thank you everyone for taking the time to do this orientation with everyone. I'm Bernice. I just was wondering, I don't know if you're from Chicago or not, but I was wondering if it was difficult to find housing and how did that look like if you needed a car and just the situation, because I haven't been to Chicago, so I'm not sure.
Yeah, so I'm not from Chicago initially, though I was living in Chicago when I started the program. So I already had an apartment and was settled. But I know many of my good friends in the program. I happen to be close with a couple people who are from California and had never been to Chicago or were moving to Chicago for the first time to start the program. And from talking with those people, it seemed like finding housing wasn't too challenging. There are a couple avenues that Rush has that can help. One, it's not necessarily through Rush, but something that once you decide to apply and you get accepted will be created as like a Facebook group for your program or for your cohort. So like I was in cohort 21, we had a Facebook group that people could join as soon as they found out they got in. And a lot of people found housing or roommates or things like that through the Facebook group. Another thing that Rush offers is they do have Taylor Lofts, which is something that, especially if you're just moving to Chicago, it could be like a night. I know some people kind of used that as a bridge where they lived there for like term 1 and 2, and then moved once they got a better sense for the city. So that's just student housing that you can look more into on the Rush website. And then I believe there's also information on like brokers who can help look for apartments that Rush has on their website as well. And then as far as a car, it really just depends on the neighborhood you live in and kind of your preference. Like I had friends who lived out in the suburbs and would drive in like an hour to an hour and a half for class, but that worked for them. They liked to listen to lectures in the car as they were driving. And they kind of like liked that time in the car. I knew other people who there was no way they were going to want to get up that early to get to clinical, and they wanted to live walking distance. So it really just depends on the neighborhood. Chicago has great public transportation, especially depending on what neighborhood you're in. So I think a car, it really is like sort of personal preference, personal ability to have one, and also where you decide you want to live. But it's definitely possible to live here, go to clinical, and go to school without one.
Okay, that's a very important point that you raised, and I just want to reiterate that some people say, well, what can I do as I'm waiting for a decision, or I'm waiting for classes to start. And really, one of the most important things is just to increase your self-awareness and get a sense of what works for you, because we have some students who they absolutely do great by taking the train and listening to lectures and studying during the travel time, like Kate said. And then we have some that try that and they just don't do well at all via that method. They really need to be close, and maybe studying with a friend is better for them, or having a tutor is better for them. It really is important for you to get a sense of what strategies work best for you.
Thank you so much. And if you don't mind me asking another question, like why did you decide to go to Rush University?
Yeah, sure. So my background was not in anything related to nursing. I actually was a history major, and I taught high school history for a few years before I decided to go to nursing school. And as I mentioned, I was in Chicago. I had moved here and was taking the prereqs for nursing school here in Chicago. And as I was doing those and looking around, I knew I wanted to stay in the Chicago area. So I know there's Rush, there's DePaul, there's Loyola, there's, a couple places to look into. So I was looking at those. And for Rush, I just found that I knew I wanted to get a master's if I was going back to school. Because I already had my bachelor's, and I just felt like that was something that I felt was important to me to have. And then the more I looked into Rush, the fact that there is the CNL component, and that is something that I thought was a real value add for getting that degree. And then the more I talked to faculty and talked to other GEM students, I found that it seemed like a place where most of the faculty are practitioners as well, so they bring that experience. And it just seemed like they worked so closely with the medical center, and I really liked that things were so intertwined. And it felt like when, just even when I was looking into it, that you were a student, but you were really so closely tied to the medical center. There were so many opportunities from that, be it volunteer opportunities or academic opportunities. And then I also really liked the fact that Rush is so tied to the West Side and has a lot of community involvement. So sort of all those things together made me really enjoy Rush and think that Rush would be the good fit for me. So I definitely recommend, looking at trying to talk to other students if you can, or, reaching out to different faculty. That really helped me in making my decision. But yeah, sort of all of those things together just seemed like a good fit for me.
Thank you so much, Kate.
Sure. Anything else that we haven't touched on? Can be about anything with the academics or clinicals or anything.
What's your capstone project, and like how did you choose it?
Yeah, sure. So for my capstone, I knew I was interested. So like I said, I work in the neonatal ICU. So I was sort of interested in doing something related to either that or pediatrics. I actually didn't know that was the area of nursing I wanted to go into when I started the program, but the more I got into it, the more I was sort of drawn to those areas. So actually for me in my capstone, I was lucky because, like I mentioned earlier, I worked as a research assistant in college. And the research we were doing was looking at a tablet-based parenting program for parents of children 2 to 5 years old, basically looking at how this tablet-based program could help parents manage challenging behaviors. So I was actually able to work with the head researcher for that, who was also my faculty advisor, to like sort of pull a capstone project out of that. We were starting to implement it at 2 other pediatric clinics, and I was able to work with those clinics. So I was pretty lucky in that my project kind of presented itself to me. But within my cohort, people did things like so many different things. It was so interesting what people ended up doing. Some of them did stuff based on where they did clinical or where they did their immersion, but other people were able to find projects through the volunteer opportunities that they did throughout the program. That's something that I definitely want to emphasize. I know this isn't exactly about the capstone, but just in general, there's so many opportunities to volunteer and in the community, in the hospital, and to just get a sense for what you're interested in. So I know a lot of people who are able to figure out what they were going to do with their capstone through those types of activities.
For you personally, what was like the hardest part of clinicals, would you say? And I guess like the best experience you had with being a student from Rush?
So sorry, just wanted to make sure I got, so what was the most challenging part of clinicals, and what was the second part to your question?
And what was like, I guess like the most rewarding that you got out of like Rush that took you by surprise?
Sure. So I guess as far as clinical, I guess for me, the most challenging part, which was also one of the best parts about it, was we start so quickly. Like we start, term 1, term 2, you're in clinical, and I didn't have a whole lot of patient care experience in my background. So for me, I think some of the challenge initially was I'm someone who sometimes, I think, if I'm nervous about something or there's something new, my tendency is to kind of like shy away from it. So for me, it was to really push myself to, whatever the nurse I was paired with that day, to say, hey, I'm a student, but I'm happy to help with anything, and to really, get involved. And so I think it was probably that for me, was just like getting over that initial nervousness of being with patients and not exactly knowing what I was exactly supposed to be doing. And, we were so lucky that we have great clinical instructors, and so many of the nurses, I did clinicals at Rush, but also I had the opportunity to do a few at Northwestern and at Elmhurst Hospital. And I found that all the nurses I worked with, for the most part, were so welcoming to students and made it so comfortable. So honestly, I feel like my favorite part of the program was often clinical. And I guess that was sort of one challenge. And then the other challenge is just sometimes balancing the didactic courses with the clinical, because you want to obviously be studying for your test and writing whatever paper you have due, but you also want to be prepared, in a real life situation where you're going in. You want to make sure you're ready to help take care of patients, and whatever the meds you're learning about and you're able to pass during that clinical, you want to make sure you're ready for that. So I think the other challenge is just balancing it all, didactic as well as the clinical stuff. And the most rewarding part, gosh, that's a great question and a tough question, because so much of it felt very rewarding. Every clinical, I felt like I left feeling like, even ones that, maybe were more stressful or were more challenging, I would leave feeling like I helped, and that is really amazing. I think probably for me, my favorite experience was our immersion experience. I was placed in the neonatal ICU at Rush, which is where I work now. And I was able to establish relationships with nurses on that unit. And, I did nights for my immersion, and every morning when I left, I just felt like I'd made such a difference, and I'd learned so much. Like each shift, I learned so much. And so I feel like that was incredibly rewarding. But on the flip side, sort of a different experience that was also quite rewarding was I volunteered at a place called Haymarket, which is a drug and alcohol rehab in West Loop. We have a clinic there. It used to be on Wednesday nights. I don't know when they do it now. And you're able to go, and we basically do assessments on patients, physical assessments, and take their history, and it's an intake. And that was also incredibly rewarding and such an amazing opportunity to put the skills we were learning in class into practice in, not the typical clinical environment, but in more of a volunteer capacity. And that was always very rewarding as well. So I hope that answered your question.
Yeah, it definitely did. Thank you so much, Kate. I really appreciate you just like sharing your experience.
Sure.
You sold it to me.
Oh, good.
Thank you all so much for your questions, and thank you for being able to answer those, Dr. Reed and Kate. We really appreciate it.